Hi. Hi. My name is Letitia Osei Sam. The topic of this presentation is Bachelor of Science in Nursing versus Associate Degree in Nursing in Hospital Management. My PICO statement: in a hospital setting, how does educational level, degree, or associate degree influence or predict how nurses will function in a managerial role within 5 years of graduation? Significance of the problem. The current CDC guidelines for education, all professional nursing programs, associate degree and Bachelor of Science degree prepare nurses to provide care that meets generally accepted standards. Nurse managers and leaders are responsible for guiding, organizing, and supervising nurses, overseeing nurses' aides, licensed practical nurses, unit clerks, and other administrative staff. BSN programs place a greater emphasis on topics like research and informatics, including clinical rotations in community and public health settings. The BSN programs also emphasize clinical judgment, critical thinking, and leadership. Many hospital positions are BSN preferred or BSN only. Research indicates that acute care outcomes are better when a greater percentage of the staff hold the BSN, even to the point of having lower mortality rates. According to the Organization for Associate Degree Nursing, in 2016, 81,633 associate degree nurses received their licenses compared to 72,637 bachelor's degree nurses. However, organizations are better able to make systematic change when they have more nurses with higher levels of education. An individual nurse may be performing techniques in the manner that were taught, but does each step and each placement reflect current concepts of best practice? Small differences in procedure make a statistical difference in outcome, but it's not obvious at the individual level. In the world of nursing, research isn't something that goes on in ivory towers or is limited to PhDs. Research is part of the workday world of many nurses who work at academic health institutions and magnet hospitals. Some hospitals produce an annual report specifically focused on nursing. These reports can give one a sense of what nurses do above and beyond providing care at the bedside. Premier institutions, academic healthcare organizations, magnet hospitals tend to want BSNs. Organizations that seek magnet status examine nurse-sensitive indicators such as central line infections, where it is widely accepted that the quality of nursing care affects outcome. Case study: SL is a BSN prepared nurse manager at a medium-sized hospital in an urban area. She's managing a labor and delivery unit staffed with 2 associate degree RNs, 1 LPN, and 2 nurse aides. Currently, there is a patient in labor who had slightly elevated blood pressure during pregnancy, but with diet and exercise was able to avoid medication. But on admission, an order for a blood pressure medication was written as PRN in case it was needed. As the patient progresses into labor, her blood pressure starts to rise slightly. One of the ADN nurses looks at the patient's orders and decides to dispense the PRN medication. The BSN nurse manager enters the patient's room at this time and notices the patient seems more uncomfortable, and the BSN nurse manager asks the patient if something is bothering her. The patient says that she just had a fight with her boyfriend. The nurse manager suggests a quiet environment and allows the patient to talk about her upset, thus avoiding the need for medication. SL's ability to recognize the patient's needs helped the patient to calm herself, keep her blood pressure within acceptable limits, and deliver a healthy baby. Becoming an effective manager requires the nurse to acquire new skills and acknowledge and to also undergo difficult personal change. BSN prepared nurses are exposed to many of the nurse manager's competencies while in school: quality improvement, foundational thinking skills, communication skills, understanding the effects of IT on patient care, clinical knowledge, and skills. Practice guideline. The top nursing credential for the majority of US RNs is currently a bachelorate degree or higher. Driving this movement are the Institute of Medicine's Future of Nursing reports 4 key messages. Nurses should practice to the full extent of their education and training. Nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression. Nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. Effective workforce planning and policy making require better data collection and information infrastructure. Educational practice. Though bachelorate prepared clinical nurses may not necessarily use all of their knowledge in a direct form, the content is felt to inform their practice. Some experts propose that bachelorate graduates are better able to handle complexity and uncertainty in clinical care, show greater ability to exercise formal and informal leadership, including teamwork and quality improvement. The Bachelor of Science degree in nursing is a critical first step for a career in professional nursing. The American Association of College of Nursing, American Organization of Nurse Executives, American Nurses Association, and other leading nurse organizations recognize the BSN degree as the minimum educational requirement for professional nursing practice. Evidence table. Gaps in evidence. The National Advisory Council of Nurse Education and Practice has urged that at least 2/3 of the basic nurse workforce hold a bachelorate or higher degrees in nursing by 2010. Employers are seeking nurses prepared at the bachelor's and graduate degree levels who can deliver the higher complexity of care required across a variety of acute care, primary care, and community health settings, and to provide other needed services such as case management, health promotion, and disease prevention. Federal figures project that if current trends continue, the shortage of RNs will continue to grow throughout the next 20 years. By 2020, more than 800,000 RN positions are expected to be unfilled nationwide, according to the National Center for Workforce Analysis, an agency of the US. Theory: Patricia Benner, Professional Advancement Model, the Novice to Expert Model. Patricia Benner's Novice to Expert model has been used extensively to increase retention of nurses as well as to help build experience with new nurse managers as well as administrators. She explained that development of knowledge in fields such as nursing is made up of the extension of knowledge through research and understanding through clinical experience. Expert nurses' performances are fluid, flexible, and highly proficient. They move from relying on abstract principles to using past experiences to guide actions. Change in the learner's perception of situations as a whole rather than separate pieces. Movement from relying on abstract principles to using past experiences to guide actions. Change in the learner's perception of situation as a whole rather than separate pieces. APRN implications. American Association of Colleges of Nursing believes that education has a significant impact on the knowledge and competencies of the nurse clinician. Nurses with Bachelor of Science in Nursing degrees are prized for their skills in critical thinking, leadership, case management, and health promotion. Patients deserve the best educated nursing workforce possible, states the ANCN. AACN provided several studies which found BSN preferred RNs experience better patient outcomes, greater nursing competency, more effective communication, and stronger leadership skills than their associate degree colleagues. In a summary, according to Patricia Benner, the development of knowledge in fields such as nursing is made up of the extension of knowledge through research and understanding through clinical experience. BSN prepared nurses have the foundational skills to become nurse managers. It might not yet be a trend, but there certainly is a movement among healthcare employers to hire more nurses with at least a BSN degree and to urge existing staff to pursue higher degrees. References. Thank you.